You said that you're looking at ways to do this, a Virginia initiative for our state.
Right.
In doing that, have you looked at reducing health care costs by doing tort reform for malpractice, as they did in Texas?
Yes, I think that has to be a part of it, but and when we look at Virginia, we're already posturing, I think, in a way that where liability in Virginia is capped already, and we're doing better than a lot of other states. Can we do better? I would say yes, but it's not the silver bullet, but perhaps it needs to be a part of a package. I agree. Tort reform can happen more. There's always pushback from trial lawyers when you attempt to do that, but there are ways, I think, of addressing that. But again, I would say that in Virginia, we are already doing a reasonably good job in that we put caps in place that control some of these lawsuits that get out of hand. But I'll put that on the list.
Yes, sir.
Yeah, I have a question. If under the current medical system that we have now, I can look at the hospitals in our area and they're growing everywhere. I mean, they're just growing all around. So the hospitals are growing under the current medical system. So if we start paying more money to the hospitals by the Affordable Care Act, then are we gonna look at the charges that the hospital are charging to try to bring down some of those healthcare costs?
That is an excellent point, and I'll respond to that unless you have additional to add to that. We're actually, a part of the money that would come through the Medicaid expansion, if we do that, is replacing money that was already coming out of our pockets in a different direction, covering indigent care. But in terms of managed care, just like with Medicare is a form of managed care, it looks very closely at services. So if I'm not on Medicare and I have emergency surgery and spend a week in the hospital, it may cost me $30,000, okay? Just using this as an example, okay? Okay, all right. If you're under Medicare, because of the contractual arrangements for reimbursements, those same services may be pushed back to $10,000, say as an example. But I'm saying it's already partially in place for the Medicare population. That needs to be extended in part because I read an article, I'm reading in this area a lot more than I used to, but there was a study done on just a small item, the fluid they give you, the salt water that you get.
Saline.
Everybody in here's had it.
Saline.
Saline solution. All right, the going rate for saline solution with an insurance reimbursement now could be $500–600. You know what the ingredients in it cost? Like $2, something like $2. All right, now we have to recognize that the hospitals all operate with a profit model where they have to get their money wherever they can, but that just seems a little bit excessive for something as simple as a salt saline solution, that the ingredients, including the package, can be produced for about $2 and you're being charged $500. And there may be another add-on for another $100 for sticking the needle in your arm, that type of thing. So yes, it's extremely expensive.
But you'd be looking at ways to cut down on some of the.
We have to, and I think free market can only go so far in the healthcare arena, but I think it's one of those areas where the concept of the marketplace, and if you further advance that as an example, and there's an interesting, I don't want to labor on this too much, but you brought up another interesting point because there's mixed feeling on this. There's a proliferation of these outlets because if they provide a service, then they'll be reimbursed by somebody. We also have in Virginia statutes which require a certificate of public need, and I've been reading, I think some of the Tea Party affiliates have indicated opposition to the certificate of public need, thinking that if we do away with that, that may be a way of getting more people out there competing for those dollars and push costs down. I don't have a good answer on that, but it's kind of the opposite side of what you were suggesting there.
Questions?
Medicaid expansion is part of Obamacare, and neither one is about healthcare, but it's about control of people. Max Bach has called Obamacare redistribution of income, and John Dingell said that Obamacare is meant to control the people. Well, I was gonna buy into that, and it was, Medicare was a poverty program, now it's become a middle-class entitlement.
Okay, those, I don't get advice normally from those two fellas, but the,
They're Democrats.
I understand that they're liberal Democrats. But that's a point of view. I think there's concern with socialism, I guess. That's the thing I hear, you know, and we have to be leery of that. This healthcare debate is not a new thing. It's been going on for a long, long time. In fact, one of my Republican heroes who had, I guess, a mixed message when he was there because of the times Teddy Roosevelt. And he was an advocate for health care reform. Harry Truman was an advocate. They've had different, I mean, we've been at this for 100 years. So I think if we engage, that maybe we need to stay at it until we really do something. We really need to push back on things that would be viewed as so progressive that they verge on socialism. On the other hand, you can't have a healthcare delivery system that's totally free market unless you're prepared to let people die if they can't, you know, verify that they have the ability to pay when they arrive at the emergency room. And I know that's just way off target for where we're thinking, but that's the bottom line in terms of how you address this.
There's a little competition among the hospitals, and just, when you go to the doctor, you don't know how much it's gonna be until you get the bill.
There you go. We need, and he was getting at that. I think that's a part of what we can do in Virginia, so that you know those things. Now, obviously, it's an emergency, it's a different attitude than if you have something where you're going in for elective surgery or where you're planning it. But I think that kind of information should be shared up front, and not only with the specific entity that you're going to, or doctor, but also some type of information that we can provide to you as a consumer about what's being charged by others in the area. I think that would be helpful.
Getting your house painted, but not getting your health care done?
Exactly. I think you ought to interview some people, you know, and decide where you want to have your joints fixed, that kind of thing.
Thanks, Joe Biden.
Yeah, I find that the Medicaid is one of the least efficient and most corrupt ways of doing medical care. As a matter of fact, the fraud is so bad that the FBI will not investigate a complaint unless it exceeds $500,000. Now, all of these reforms that you're talking about should have been going on already.
Definitely.
Not just bring them up now so that we buy into this. The other thing is enrichment. I heard these Medicaid providers talk about the unbridled litany of services that they supply to Medicaid patients, and then just send the bill to the taxpayer. Meanwhile, Medicare, we're gonna have to deal with boards that are gonna decide whether we can or cannot receive a treatment. Why aren't these boards being talked about for Medicaid patients? Why are they allowed to just go in for any treatments, get all the treatments they want, and it doesn't cost them a dime?
Well, there's some validity in what you're saying there, and particularly for why hasn't this been fixed before, but from my position, where I'm at right now, I can't undo the past. You know, where obviously we shouldn't have fraud in the Medicaid and Medicare program. But I believe if we focus on it now, which we are, we can successfully eradicate most of the fraud in both of those programs. And it's everywhere. It goes back to the ethical underpinnings that I was talking about earlier. People shouldn't, you know, people that are in dire need of health care shouldn't have to be concerned about being ripped off, but they are. As taxpayers who have the compassion to take care of people who are less fortunate, we shouldn't have to be concerned about being ripped off, but we are. So that we have to address that. The other part of your comment there, and I kind of got off track there. Your other concern that you want,
What the services that are rendered to Medicaid patients, it's
okay,
just
oh, I
unbridled.
know where you were going with the, this notion that some committee will decide whether you live or die. Obviously, we can't allow that to happen, that it has to be a relationship with a doctor. And many of y'all probably already been there in that little huddle with a doctor and some close member of your family where you had to make a decision about whether you were going to continue to spend money and put them through agony, or whether it was, the good Lord was calling them and their systems were shutting down. I think one of the areas.
No, that's not what I'm talking about, when a board is gonna decide whether I should get a new hip or not. Am I worth it?
Well, that's the kind of decision, and there is nothing that I'm aware of that's been proposed that would suggest that anybody who's not dying from some other cause should be denied some type of procedure like that. What I was getting at with that, there are ways of limiting the amount of money that's spent in end-of-life decision. And I think one of the things that we could focus on, and it's been suggested in Michigan as one of the initiatives that would be a part of healthcare or Medicaid expansion, is at least making sure that everyone is familiar and given the opportunity to complete an advance directive, so that you have that type of information available ahead of time, so that you don't have this tough decision about whether you're going to spend another couple $100,000 just to sustain an individual, to make sure that their wishes are known ahead of time. So I think you're obviously, all of these things, there's no clear cut when you're talking life and death and human health. Sometimes there's no clear cut answers. So I think your concerns are well founded.
Yes. Emmett, I look at this, and I have sort of a broad philosophical question for you. I'm interested in the interaction between the federal government and the state government, and you point out quite rightly that the federal government really needs to get its act in order. It's $17 trillion in debt. It's almost a hopeless situation. And from a state legislator's perspective, I think the federal government puts you in a position and puts our state government in a position where they dangle money out in front of us. And they say, look, here's some free money. But we know it's not free money. And I wonder, as a state legislator, philosophically, how do you counterbalance your, on the one hand, your duty as a state legislator to consider whether or not you take this so-called state money, to our duties as Americans to try to protect our country from going deeper and deeper into debt and launching an expansion of a program where we can't even afford what we have right now.
Right. That's a very good and broad question, and I'll address it in this way. I've already mentioned that there was a dedicated revenue source that was created specifically to fund the program. So that's one part of the answer that I would make there. The other is, yes, we're going to have to come to grips with the federal government's inability to balance their budget or even approach a reasonable budget. But in this instance, I guess I would take the position that Governor Kasich took in Ohio when he was asked that question. You know, if we turned down that $2 billion and they set it aside or made a payment to the Chinese on the notes we owe, that'd be a good thing. That would be a good thing, all right? But they're not going to do that. They're going to spend it somewhere else. And when we think philosophically right now about where we are with the federal government and many of the businesses that we have that thrive on doing business with the federal government, the fact that we have a partnership with the federal government, that anytime we can get a grant, we go after it. Anytime we can get that extra dollar. We built $1 billion worth of highways in Virginia with monies. in the aftermath of the recession with the stimulus plan. We built $1 billion worth of highways. We didn't turn that down because, you know, we were concerned about not making a payment to the Chinese. So I think we're in that quandary now, though, and I really believe and I hope it continues to be one of the foundation policies of the Tea Party is that you are relentless in suggesting that the federal government balance their budget. But we also have to recognize, hey, life is going to change here in Virginia if they do, because we are already importing a tremendous amount of federal dollars. Now that's tomorrow, and they have to address that. Right now is today, and if the money has been taken out of our pockets already, it's already being taken out of our pockets to fund this program, I think it would be short-sighted on our part if we could do it our way, not to at least consider bringing it back. So it's a great question, and it's something that I certainly struggle with right now.
Mr. Hanger, I would like to know, I used to work for the Medicaid unit in Rockingham County.
Okay.
And to apply and to be considered for Medicaid, you had to meet certain criteria. One of it being financial, the other being you had to be a child under the age of 19, up to 19.
18.
And then you had to either be a pregnant woman, blind, disabled, or handicapped, or elderly. This Medicaid expansion, what is it expanding? Is it going to do away with the criteria that you have to meet to become eligible, or is the monetary financial part of it being expanded to, instead of being low income, it's going to be people of middle income qualifying?
Okay. All right. That's a good question for clarification. Currently in Virginia, as you suggested, pregnant women, children, 18 and under, and they're covered up to the 138% poverty level that we're talking about, all right, which for an individual is about $15,000. The parents, unless you're pregnant at the time, but the mom and dad that has the children, they do not have benefits.
Right.
No matter what their income. If they're working, down at the factory and bringing in $10,000, they don't have benefits. In Virginia, also, seniors only have a certain amount of up to a certain level of income, which is right now about 80% of poverty. You're entitled. Under this program, that would go up to 138% of poverty. So you're talking single individuals currently have no coverage, period, through Medicaid. Under this program, if your income was up to 138% of poverty, you would be eligible for benefits. Now that raises another interesting part of the dilemma we're in with all of the idiosyncrasies of the Affordable Care Act. That is, come the 1st of January, if your income is 100%, if you're working, your income is 100% of the poverty level, up to 400%, you're eligible for some type of subsidy in the marketplace that would afford you the opportunity to buy insurance in the marketplace for insurance. If we don't expand Medicaid, then these individuals currently that are under 100% would not have any coverage. So you're creating an individual category of individuals there that if you're trying to get a system, which it wasn't me that was trying that, but that's what we're working for, a system where everybody has some kind of coverage, then those who are from 0 to 100% of poverty that are not already in one of those qualifying categories, either a child, pregnant woman, which also brings up another area where I think we have a tremendous opportunity to save money, and this goes back to the ethical underpinnings of this nation and this state. One of the huge costs for Medicaid for these pregnant women is the fact that a high percentage of these pregnant women are not married, no income, and Medicaid is paying for the delivery of their child. Now, once they're pregnant, I think we would all say, well, you know, that young lady needs treatment and her child needs care. But there's a decision that's made before they get pregnant. And that's the area that we're gonna have to address, in my opinion.
Yeah.
Mr. McCullough was quoted as saying that if the Virginia General Assembly does not approve expanded Medicaid, he would not approve the budget. How will the Assembly respond to this type of tactic?
He would not approve the budget?
Right.
Stepped on my shoestring here, excuse me. He's liable to say a lot of things. I think he's, you know, it's just like Obama's our president, now it looks like Terry McAuliffe is our governor, will be our governor-elect. And so, he's a liberal, I'm a conservative, but while he's governor, we can't afford for him not to be successful. Now, we can keep him in line, and that's what I would hope we would do. I believe that we need to work this out, that if we need to do it Virginia's way, and I don't believe he will be in a position to dictate whether we're going to expand it or not. It's a part of the process that we always find a way of coming to a consensus in Virginia, and that's what we'll attempt to do. He also made some remarks about taking some of the savings out of the Medicaid program and paying for other things with it. I don't see that happening either. I think we need we have a lot of, it's true, we do have a lot of unmet need in the area of healthcare, but I'm certainly not supportive of squeezing money out of the healthcare system to pay for education and other things. We have to pay for that out of a different pot.
Okay, coming back to the next one. Yes, sir. Got first on the end.
Dan Springer.
Hey, Dan.
How are you doing? All right. You mentioned, I was glad to hear you say that Medicare has been paid into by virtually everybody in this room. It is not an entitlement, it is expense. But I see the same thing happening with Medicare that's been happening with Social Security. Here's this bucket of money, and the president is going to take $500 billion out of Medicare to pay for Medicaid and other expansion in healthcare. And I think that is immoral, and it should be illegal. Now, I don't know if you have anything dealing with Medicaid and some of the things you were talking about. The reason I think that we need to look at some form of a market approach to it, free market approach to it, is that we stand a good possibility of losing some of the insurance companies that are currently operating here in Virginia. New Hampshire, it turns out, has only one insurance company that is going to be working on the market, federal marketplace, and that's Blue Cross Blue Shield. They're going to lose every other insurance company in the state in that regard. And I think that one of the things we have to be concerned about with any plan that we're working on is that we somehow maintain the viability of insurance companies in this state. And one way to do that is to have a market approach in terms of perhaps, as you mentioned earlier, support for purchasing health insurance for Medicaid people and so.
Okay, a couple of good points. On the last point there are some approaches the other states are taking, and we're looking at that would essentially underwrite a portion of the premium to a commercial insurance carrier. The concern that I have, which would need to be addressed, is if you just put more money out there and you don't do other things to control overall healthcare costs, it just helps drive the cost up. The bigger pool of money that's available to feed the animal, the greater the inflationary rates tend to be. So we'd have to look at that. The other part, you know, there was a big debate about that at the federal level, and the Hospital Association at the federal level agreed to that, in that part of that was supposed to come from the addressing integrity of the program, from eliminating fraud in the Medicare system, and some of it was that the hospitals agreed to a reduced payment rate in part to accommodate those savings that they were anticipating in the Medicare program. But, you know, it's like, when you mention Social Security, it's right, there's no, that the money is fungible, and Congress certainly plays pretty loose with that. The Social Security system, one of the things that's fallen to the bottom line in the last several years at the federal level is just that, the Social Security system. The Social Security system, if you go back to the middle of the Bush administration, was still contributing $500 billion to the positive side of balancing the budget. But none of that money, as we're all painfully aware, was being put in a piggy bank. It was all being spent. So now the current responsibility has to be paid from current operations. Medicare, you're right, you've got to make sure that that remains viable, and you know, as good as it was, and the adjustments have been made, I still had a problem with how the Medicare Part D was addressed.
Senator Hanger, my name is John Burrell from Waynesboro, Virginia. And
Yes,
just
John.
remember, we talked about balancing the federal budget. They have not had a budget in 5 years. There's no way we can balance something that didn't happen. We talked about the same subject on a mention night 4 weeks ago when we were in Verona. You mentioned that right now 22% of our budget in Virginia covers legal expenses. And I ask you this question, is we're not only talking about today, we're talking about this program 5 years down the road when there's no federal aid. Who's gonna pay for this? We're gonna be maybe 40% of our total budget. Who has to pay for it? Is us people with taxation. Now, have you considered what you're planning on doing? The same question I asked you 4 weeks ago. Have you considered what we're planning on doing to cover all those expenses? Because this program is not gonna stay flat. And what the taxation is gonna be on the public of Virginia is gonna be serious. Because none of these programs stand still. They go up and up and up. And our taxes go up and up and up. And our assets to live go down and down and down. Thank you.
Okay, on projecting it out 5 years, under the law, the federal law that was passed, it would be sustained at 90%. Now, you know, we've been talking around that subject, saying, well, maybe the federal government won't be able to sustain that. But under the law, it just doesn't go away after that. It would be sustained at 90%. So the state would have a responsibility for picking up 10% like currently now. When we add somebody to the Medicaid rolls, the federal government puts up 50% of the dollar. Now, the trajectory, there is a tendency for that, and actually that's why I feel we can't do nothing, because the healthcare trajectory has been going up and up like that. One of the problems, of course, with the federal budget is that the Democrats wanted to spend more, and they were perfectly willing to raise taxes. Republicans, it seems, were perfectly willing to spend more, but they didn't want to increase taxes, so they substituted debt. Now, your taxes haven't really gone up significantly. It's just that we're on shaky ground because we've opened up the deficit to unsustainable levels. The last time the federal budget was balanced, it was roughly 19%. Federal spending was right at 20%, slightly less, about 19.2% of our gross domestic product, and the revenues were right at 20%. So you had a surplus. That's pulled apart. Long term, it looks like now we are raising revenue, which is equivalent to 15% of our gross domestic product, and spending in excess of 25% of the gross domestic product. And of course, there was a spike with the stimulus funding during the recession, but long term, that's where they're at. And you can't sustain that. So John, you're exactly right, but we have to build our programs based on the law that's in place now. And that's why I'm leery of expansion, but I think it's, given the fact that that's the game that's being played, and human lives are in the balance, and the viability of our healthcare delivery system, that's why I'm considering it with appropriate reforms that we could move forward with expansion.
My name is Cindy Barrett. I'm from Waynesboro. I'd like to thank you very much for coming and spending time with us. I'm sure it's not always easy. I have a two-part question, really. One of the things that you had said initially was that you felt like we needed to do something that it would not be a good idea to stand still. The other thing that I heard you say in your opening remarks was that people need, and I may be misinterpreting what you said, but it sounded to me like you believe that people need governmental help. And I think fundamentally, we agree on principle that something needs to be done with health care. I think we disagree on how that should be done. I know that we have Obamacare, and I know there's a lot of things going on with Obamacare, but given the fact that we have a federal government that's $17 trillion in debt, part one of my question is, have you produced a Virginia budget with Medicaid expansion that includes no federal dollars? Can you keep Virginia safe, expanding Medicaid without regard to money that you're going to get from the federal government that at some point will implode? That's part one of my question. The second part of my question is, you mentioned Governor Kasich of Ohio. From what I understand, the legislature said no to expansion, and through some kind of executive whatever, he did it anyway. Would you be in favor of our governor-elect to be doing the same thing, and would you support him in that effort, or would you do something, if he stepped in, to do something like that?
All right, two good questions. The first one, relative to run numbers that if we didn't have the federal government contributing to Medicaid, how we would fill that void. There's, at this point in time, the partnership is too deep. We wouldn't be able to do that without significant, huge tax increases on our citizens. You're talking about in the area of Medicaid, over $3 billion annually already coming, $3 to $4 billion annually coming from the federal government. So it's like, it's a question that simply can't be addressed at this moment in a realistic way, because we have many other programs as well. It's just like if we were to say at the state level, and looking back at local government, if the local government were to try to build a budget based on not having any state dollars, your real property taxes would go up fivefold. It's just not realistic. Now, long term, I really believe that we are going to have, in many areas, we're going to have to reduce our dependence on the federal support. But it's going to be tough. That's why I'm suggesting that if the federal government really does get serious about balancing their budget, they're going to push back on the states in order to accomplish that in part. So that's a tough call, but yes, I can run, Virginia, if we want to just talk raw numbers, Virginia is actually a very affluent state. Our gross domestic product in Virginia is over $400 billion a year. So we have a vibrant economy, and that's a good thing. It needs to be a little more vibrant right at the moment than it currently is, because we still haven't totally recovered from the recession. But for the most part, it's balanced and it's vibrant. We would have the ability to fill that $3 billion hole, but I don't think there would be an extreme willingness on the part of taxpayers to shoulder that burden. It would take a significant increase at the state level in sales tax. You'd have to go up a couple cents on the sales tax in order to fill that kind of hole. So that that would be a tough political judgment that a lot of people would be involved in if you were to do that. Fortunately, that's not the question that's confronting us now, but obviously if our federal government becomes non-functional, which some would suggest they're just about there, we would have to be looking at things like that. The second part of your question, and I didn't get it totally written down here, you just give me a hint on where you're going with that.
The legislature in
Oh,
Ohio.
I've got it, I remember. Kasich thought he had the ability in Ohio, based on his revenue commission, to accept those federal dollars and spend them. The governor of Virginia does not have that authority, and so we would totally resist There's no way that the governor of Virginia can do that without the involvement and approval of the General Assembly.
Yeah, I'm Stuart Bossman in Stanton. I have not been an advocate of Obamacare at all, and kind of hoping I could just ignore it, but it hasn't worked out that way because my family's one of them that lost their insurance as of December. Insurance sends you things and say, now you can get this on your own. Well, it's ridiculous. It's anywhere between $5,000 and $10,000 deductible, and that's the only choices you have. My problem with Medicaid expansion is, if this is already to this point, you know, because I worked with therapy, and I met people that have care in South Africa they dealt with, England, and same thing is what we're going to get with Obamacare, basically take care of everybody, and nobody gets to get taken care of. And I see that happen, and now if we expand Medicaid, it just seems like there's going to be more and more money having to go out. I just don't see how we're going to keep up with it, even statewide, let alone, you know, government-wide. And I'm afraid, just like a lot of the other people here are, that the government's going to run out, and we're going to be stuck with who knows what, you know, and I just don't see it working. That's just my opinion.
Well, I would share those concerns. We're going to have to address some fundamental issues in terms of affordability for a number of things and a lot of levels with that. You know, I'd be interested in following up with you if you'd like on your personal situation there to see, because I'm trying to figure out some of that, because I've met just recently with the insurance association folks who tell me that, you know, that if that happens, you can get an affordable product replacement, and there are ways to do it, but I don't know. I don't know, so maybe I could just talk to you individually on that.
Well, I do think too that employers are misunderstanding what they're supposed to do, because my wife works for an organization that is a big company, but they're little franchises, and they said, well, you know, if we have less than 50 on the care, then we don't give it anymore. We can't give it even. We wouldn't even be allowed to give it. And I'm wondering if they even understand what in the heck's going on, because I think a lot of employers don't even really grasp the whole thing, and they're just doing it for survival. And they might not even have to.
Survival, and in many instances, and that's a part of the ethical undertaking, sometimes it's greed. I mean, we know that that's a part of what's going on out there. I talked to a relatively large employer just last week who was dealing with that situation, and he provides group insurance, good group insurance for his employees. And someone had suggested to him, hey, you don't have to do that anymore. You can get people to work for you. There's people out there needing jobs. You don't have to do that. His response was that you know, he had a conscience, that if he was earning a good return on his investment, he wanted the people that work for him to be able to have health care service for their family. So he was willing to do that. And, you know, obviously, that's a deeper problem than just what we're talking about tonight, if we have that mentality prevalent in this country.
Do you have any idea how many people in Virginia had that situation happen? Do you keep a number of, has anyone said how many people lost their insurance due to Obamacare as of Virginia as a whole? Do you have any numbers?
It was 12,000.
No, we don't have those numbers, and that's why I'm interested in tracking that to see if we can follow up on that to see what the situation is.
Okay.
Okay.
Those of you who oppose expanding Medicaid, will you raise your hand? May I assume that those whose hands are down approve of Medicaid?
No. How many abstain?
Anyone
Just don't
approve of
understand it.
expanding Medicaid?
I'm not sure that's a fair question to put to the group here this evening. I expected everybody to come here with concerns about it, and I expected no one really to raise their hand and say, I'm all for it. What was your point? That I should recognize that nobody likes it?
I was
Yes.
interested in knowing how many of my fellow citizens think like I do or oppose mine.
Okay. Okay.
And I hope that that would carry over to your opinion as well.
Right.
Thank you.
Thank you.
Okay, I think I had someone here asking a question.
My name's Baldwin James. How you doing?
Doing good, how you doing?
I'm retired military, been around the world a few times, 6 of the 7 continents, every one but South America, and I missed a trip there before I retired. Anyway, you know, we get involved in these wars, which we shouldn't get involved in. And because these wars cost us a lot of money. I put 5 years in Nam, and I wasn't over there too long before I figured out we shouldn't have been there. But, you know, that was my life, and I did it then in Iraq, Iran, all these places. You know, they're mostly religious type wars. There's no winners in religious wars. And we need to take care of our senior citizens. Every president I can remember has tried to get some type of health care plan through. And thanks God Roosevelt did get the Social Security through that. Social Security is probably about a fifth of my income. And I imagine everybody else is in here. But if we didn't have it, we would really be hurting. The bottom line is, we got Obamacare. I don't know whether it's a good plan or a bad plan or not, but it's banned, it's law of the land. I think we should make an effort to make it work. I've been in Europe, all through Europe, all of them got, you know, you go to the hospital, you might have to pay 15 or 20 bucks instead of 15 or 20,000. I just had my hip replaced here the 17th, and of course I got TRICARE for life. I mean, and I felt I earned it for 20 years in the military. And I felt I earned it, but I really feel sorry. Somebody's got to go over here to a free clinic, and I have donated a little money to free clinics, but it's like sick call in the military. You run down there, they go through some APCs, GI Gen at you. You run a temperature, they'll give you an excuse to get off work, give you non-con, you know, get you off work. But the free clinic, we need a good health care program, and we got to make it work. And like I said, every president I know of has tried to get one. We got one, and then they're bucking it, trying to get rid of it. Hey, I had no problem with spending $1,000–1,500 billion on our people here. What upsets me was spending over here on the war, around the world, in wars that we ain't gonna win.
The point you raised, and the gentleman before, I didn't mean to appear to be rude by his question. What I was basically, and I understand that there were a lot of phone calls made, so people were coming here specifically to let me know that they opposed the expansion. So, and I'm good with that. That's why I've been trying to share a lot of information so we can have an informed discussion about it. But I didn't want, sometimes it's intimidating to be in a group thinking, well, maybe there's some merit to this, and everybody else is going to beat you over the head if you show your support. So that's why I was a little hesitant to that.
You want to say? Go ahead, ma'am.
Yes. Evelyn Durstein from Rockingham. I really appreciate hearing you for over an hour telling us all the various committees you were on and all the money you were saving us. Now, how are you going to return that money that you saved to the individual taxpayer, not the resident? You may not be happy. After you get around to returning it, I don't expect to hear you say, well, we're gonna take it from you, and we saved all this, and we're gonna give it over here to this guy. Because those of us sitting here who have worked know that a dollar earned and not saved is wasted. It's spent. It never comes back. And I don't care who you spend it on. And there's a limit to our compassion.
Exactly.
How do we get it back? I mean, you were telling us how we saved it.
Okay. All right. Well, let me share a bit of that with you, just in a general way. And I think y'all saw some of the repercussions of it here over the last couple of years with your local boards of supervisors. In Richmond, we have to have a balanced budget, and we balance the budget. Sometimes we balance the budget by not paying back to local governments as much money as they think they need to operate their local governments, pay their teachers, pay for the sheriff, law enforcement, all of that. If we don't, so if we save $100 million in health care above and beyond, it comes back one way or the other because it all falls to the bottom line. The last several years, the last couple of years, well, just in terms of developing the budget, I know that's the way it works, and I hope I didn't spend too long talking about what committees I was on, but I think our conversation has been deeper than that. The Augusta, Rockingham, Stanton, Waynesboro, all of those areas, and the other areas, we've had a gentleman here from Green and beyond, but it's a partnership with local governments. My opinion is one of the most onerous taxes that you as taxpayers, we all face, is the real estate tax, because it's not a reflection of particularly of your ability to pay. And if we don't save money when we can at the state level and apportion our spending so that we're taking care of responsibilities at the local level, then you get your real estate tax raised. And that's what happens sometimes. So that's part of the mix. Beyond that,
So if we kept it locally, we could
Ma'am?
better, if we kept our monies locally and stopped sending it to state, we could better manage our county, our municipalities.
You would think that, but that, in Rockingham County as an example, you know how we pay for your schools? We pay for it with 35% local dollars and 65% state dollars. So there, if we were to let you fill in that other 65%, and when I say we, it's us. We're all working together on this. So I think you have to look at the broad picture of
But you
funding.
take it from us first.
Actually, we take it from Northern Virginia and give it to you.
Oh, and they're not
Okay. Your point is well taken. I think there's particularly in there are groups that are just had it enough with taxes, and I understand that.
I have noticed oftentimes we seem to use the terms insurance and healthcare interchangeably. Now, it's quite different. Really, what we need, what people need is healthcare. Now, we've had healthcare in our area in Virginia for quite some time. We call it a free clinic. You was referring to that a while ago. And a friend used to work there. She said, as long as you did not have insurance, you could get help. So what we're talking about here, we're talking about Obamacare, you're talking about insurance, nobody can have insurance. It's a whole different thing. We don't need insurance. We need health care. And I think that's one of the things we should make sure that we keep that distinction and don't confuse it at all. One other thing, which is a very minor thing, but an experience I had some time ago, and I'm sure it relates still today. The first time we got the prescription card, you had to pay $2 for a prescription. I had a prescription bill. I forgot that we had the card. It cost me $14. My wife said, why didn't you use the card? I said, I forgot. So I have it refilled. I used the card. I paid $2. But the receipt showed that they had billed the insurance company $24. I think that type of thing is still going on today. That's one of the problems. We're talking about fraud. Correct.
We're working on the farm.
There's that.
Yes. They're almost like to get to the back.
Okay. Hi. I have a question. I've heard you talk public policy all evening long. My question is, in the public law that is the Constitution, for the United States, the Constitution for Virginia, what is there in those constitutions that permit you to go ahead with Medicaid? On what basis of the law can you justify any position of the General Assembly going ahead on Medicaid?
Are you suggesting that we don't have constitutional authority to have a program like that?
I'm asking you, I've asked you a question.
Okay.
And I would like to hear your answer.
Oh, my answer? Okay.
I'm not here to educate you this evening.
Okay. Well, the Supreme Court made a determination on that, and so that would be my technical answer from the standpoint of Virginia's Constitution and the federal Constitution. We do a lot of things that are aimed at quality of life. One of those things we started out that was fundamental to the beginnings of this country was life, liberty, and the pursuit of happiness. So I think life is pretty fundamental.
My question is a law question. And I'm not asking for what the Supreme Court interprets the law as being. I'm asking for what is your understanding of what is the law in the Constitution that would permit the General Assembly to go ahead with a Medicaid expansion enactment. I'm asking you to give me the basis in law why you think you can do this.
Okay, I guess if I were going to be accurate, I would need to respond to you later on that, but it would be the same basis for which we have the program to start with. If you're suggesting we don't have the constitutional authority to have a program to start with, because it's, you know, we're just talking about an expansion rather than creating a new program.
Well, I'm not alleging anything, I'm just asking you
Okay.
for a law response. What permits you to go ahead in a lawful way?
Okay, our Constitution,
Bearing in mind.
our Constitution allows a lot of latitude in Virginia within parameters based on the will of the people. So I think there are a lot of things that we do that there's no specific language that says, you know, if you develop, you know, that you are allowed to develop a program to provide insurance for low-income people. There's no basis for that. But in broad interpretations at the Virginia Supreme Court and Federal Supreme Court, that they would allow that. And again, I'm not a lawyer, but I can try to get a legal opinion for you if that's what you're interested in.
I would certainly appreciate to know the lawful basis of.
I think our
I mean, the word legislature,
Right.
legislator, it
Right.
has to do with the Latin word lex leges, meaning law, right? So I would think the law would be the primary consideration of the civil magistrate in the General Assembly.
Right. It is, and I wouldn't claim complete ignorance on the subject, but based on interpretations of courts and even the positioning of our current Attorney General, who's never challenged the appropriateness of the Medicaid program, I think I would have the concurrence of a lot of legal scholars that it is legally okay. Whether or not it's appropriate is another question. I didn't catch your name?
It's Julie Sensible from Stuart Stroud. I've heard a lot this evening about government being the answer. And I think we're lost in, what about personal responsibility? You know, everybody has a certain responsibility to their own health care, their own insurance, and yes, there are people that need help or assistance, but by giving more and giving more and giving more and putting the burden on the taxpayer, not everybody who lives in the state pays taxes. So, you know, I guess I'm lost in that. You want to expand it further within the state without any true answers as to what's going to happen 5 years from now, if or when the federal government decides that they don't have the money, what that's going to do to people who are paying taxes in the state.
The
You know, where is that personal responsibility?
well, again, personal responsibility has to be there.
But it's not there if you're going to give it to them.
Well, it depends on who the them is that you're talking about. There are individuals that, you know, unfortunately, sometimes because of this spiraling cost of health care and insurance, don't have the ability, whether they manage their finances appropriately or what, the ability to do that. Now, the other part of that, it goes back to, you know, the constitutional issues that the previous questioner was raising, in that the only way for your proposal to work appropriately is if when someone shows up at the emergency room without the resources to pay, that you say, sorry, we can't take care of you.
So is that what you're implying now? Is that when somebody goes to the emergency room, that they're not being helped?
No, they're being taken care of.
Or
But
that's what's gonna happen if you do not extend
if
it?
they're being taken care of and you're already paying for it, that's what I'm suggesting, in a very inefficient way. Because if that individual would have access to preventive health care and knew that they had cancer earlier, then it may not be as expensive to treat them. That's a part of the, you know, you may agree or disagree with that, but that's part of the debate that's going on. And the Supreme Court has ruled, you know, as well as I think our personal conscience would say, you know, it's like the young lady who got pregnant. You know, we might have a lot to say about whether or not she should get pregnant without the ability to pay for the delivery of that child and support of that child. But once that young lady shows up at the hospital and needs delivery services, she's going to get it. And I think as a society, we recognize that's what should happen, because we value human life. But, so that's where the rubber hits the road. You can't say, you know, if you're poor and don't have any money to pay the doctor, then to heck with you. That's, you know, we can't do that.
That's not being said now.
That's what I'm saying is that's right. We're already paying for it.
But you're wanting to expand that.
No, we're already, that person that doesn't have insurance now gets their care either through the safety net, which was mentioned, that we have the free clinics, which take care of part of that. We also have a healthcare foundation, which we're using in Virginia. Some of the tobacco settlement money that 40% of the tobacco settlement money that where they sued the cigarette companies and got a big pot of money. Some of that money we're using to support a healthcare foundation that works to provide health care for individuals that don't have insurance. We also have a safety net from, again, federal tax dollars that are coming to Virginia for these federal clinics that are being set up. So what I'm saying is, the money is already being spent, but in many times inefficient ways, because that person is going to get taken care of, but we have to pay money out of the state treasury, your taxpayer dollars, to the University of Virginia, Virginia Commonwealth University, and the other hospitals to reimburse them for indigent care when they take care of someone who doesn't have insurance.
Well, I don't think anybody disagrees that there needs to be some type of reform, but, you know, there's different things, like
Right.
spending accounts,
Yeah.
catastrophic insurance, you know, people have to look out for themselves.
Individual responsibility is a key item. I think you're right on with that. And again, it goes back to the underpinning of this country. If everybody, you know, we have a country that's not quite where it used to be.
My name is Jeff Schmiegel. I'm from Waynesboro.
Jeff from Waynesboro, okay.
I'm originally from Buffalo, New York, so I've got a wide range of different ideas, a different perspective from what you're used to. First off, I also want to say thank you to you, that gentleman over there, for your service to our country. Okay, that means I also want to say thank you and your members here for allowing anyone just to come in and participate in this meeting. I really do appreciate that. There's been a lot of topics that have been touched here. I've been taking a lot of notes here. And I myself was originally raised on Medicaid. I worked myself off of that, and I raised my family of 3 children, my wife and myself, okay, to where we don't have to participate with that. And I thank God for His mercies to where He helped me be able to achieve that, okay? But there's a lot of misconceptions about what Medicaid does and does not do, such as there was a lady earlier today that mentioned that Medicaid will allow you to go ahead and take a name brand drug over a generic drug. That is not true. Medicaid will go ahead and force you to take a generic drug if there is one available. So whoever mentioned that earlier, I'm sorry, but you are misinformed. That is not possible.
Tonight's
Okay, that's a
MPR,
safeguard that's in place, has been in place for well over 40 years. Okay? Now, there's another misconception in place as far as Medicaid will go ahead and stop you from getting current necessary treatment if necessary, as far as being put on your waiting list to die, that was touched earlier, okay? That is also not true. But if you look at your current HMO, your paid policies that are available, okay, for which I've been on, because I've worked for Fortune 100 companies for which I've retired from, okay? I was the #1 sales agent for Microsoft for many years. I retired early because of the Lord's gift to me of sales, okay? I worked for them, and when I retired, first thing I did, terminate my health care. Okay, and the reason they terminated me, because I didn't work for them anymore. Now, you want to talk about COBRA insurance? $500 a month premium for one. $750 a month for myself and my wife. Not talking about my children. Over $1,000 a month premium on COBRA. And that's under your paid health care. Now, on top of that, you want to talk about getting necessary treatment? My wife is disabled, has been since 1999. Okay, when we were just dating.
She has been denied coverage until she got approved for Medicare. Medicare itself will cover a majority of her treatments. Now, the new policy of going ahead and subsetting or getting all this other HMOs to go ahead and correspond with Medicare, the HMOs keep denying her services, even though they're contracted with Medicare. They keep denying her and making her get pre-approval authorizations and making her go through this and that. That's what's wrong with our healthcare industry right now. And it's not just Medicaid, it's Medicare, it's the HMOs, it's all of it. Now, Mr. Hanger, Senator, okay, you wanna know what's wrong? It's not the Medicaid expansion. We need that for all of our fellow Americans that are not insured. Okay? You served our country, sir. You know what I'm talking about, just as you put it in a lot better words than I can. Okay, we're spending billions of dollars in wars that we don't need to be fighting. But yet we can't help our own fellow Americans right here on our own land? What is wrong with that picture? We've got children that are going uninsured just because their parents make $500 a month too much. And I'm more than happy to go ahead and pay a little bit more in taxes if necessary, to make sure that children and those who are working poor, they're working their keisters off to go ahead and make sure to feed their family, but they can't afford insurance. Yes, expand Medicaid, please. Do everything you can to protect these children and the working poor. Because that's what is bottom line. Okay? I know it's ask not what you can do, what your country can do for you, but what you can do for your country. But guess what? They're doing everything they can for their family. And as the Lord is my witness, I'm going to do everything I can to help them provide for their family first. And that's what we as America was built on. And correct me if I'm wrong, but that's what we were built on. Now, I think we all need to step back and stop worrying about the taxes going up and getting them refunded to us. We need to go ahead and worry about our fellow Americans.
I think you had a motion with what you were saying, and I
Yes.
appreciate your comments.
I appreciate the time. I thank you. That is my opinion.
Okay, thank you.